Okay, let's dive in. Welcome to the deep dive. Here we take the sources you send us, research papers, reports, data, and really try to unpack what matters most, helping you get informed without, drowning in all the detail. Today we're tackling hyperbaric oxygen therapy, but specifically, we're focusing on its emerging uses, where the research is heading. It's a really interesting space. And whether you're just curious, maybe you're a patient, or perhaps a caregiver, I think understanding this landscape can be incredibly valuable.
Absolutely. And when we say emerging indications for something like hyperbaric oxygen, well, what we mean are conditions where physiologically it makes sense that it could help. And, there's some early clinical evidence bubbling up, but it's not quite mainstream yet. It's not widely approved, and we don't have those huge definitive studies for everything.
Right.
The sources really point this out. It's a challenge. A lot of hyperbaric centers are fairly small operations, so getting those big, expensive clinical trials off the ground, it's tough. It takes time.
Yeah, I can see that.
So you end up with this long period of sort of investigation,
Yeah.
exploration, trying things out. Our goal today is really to understand why it's being explored for certain conditions and what that early research might be suggesting. Because fundamentally, hyperbaric oxygen is about delivering more oxygen under pressure. And the sources suggest this might influence some really basic things in the body.
Like what sort of things?
Well, like reducing inflammation, improving circulation, helping tissues repair themselves, core processes.
Okay, that makes sense.
Yeah.
If it hits those fundamental mechanisms, I guess researchers would naturally want to see, well, where else could this apply? Looking through the sources, one thing that definitely jumped out at me was just the sheer variety of conditions.
hmm
The registry data showed such a wide range. Maybe we could walk through a few examples just to get a feel for it.
Yeah, absolutely. Let's do that. One area that comes up is dealing with some really difficult inflammatory conditions, things like inflammatory bowel disease, so that include ulcerative colitis, Crohn's disease. These involve chronic inflammation in the gut. And sometimes, unfortunately, they can lead to these awful skin wounds, pyoderma gangrenosum. They can be incredibly painful and just really hard to heal with the usual treatments.
Right, Kelly, stubborn problems.
Exactly. So the sources mention some studies looking at hyperbaric oxygen here. The thinking is by maybe reducing inflammation and boosting tissue healing,
hmm
it might help calm down flares in ulcerative colitis, maybe improve healing and drainage in Crohn's disease, particularly with fistulas, and potentially shrink those pyoderma wounds and ease the pain, especially when other treatments just aren't cutting it.
So the idea, based on the sources, is kind of like flooding the zone with extra oxygen under pressure helps calm down that internal fight and gives the damaged tissue the resources it needs to rebuild.
That's a good way to put it, yeah.
Sure.
Bringing extra supplies, trying to reduce the chaos in that biological conflict zone. Okay, so moving from that sort of internal inflammation, another really different, striking example the research looked at is frostbite.
Frostbite.
Yeah.
Wow. That's an immediate, circulation emergency, isn't it? Blood flow just gets completely shut down by the cold. How would hyperbaric oxygen potentially help there, according to the research?
Precisely. The cold severely damages blood vessels, starves the tissue of oxygen. It's life-threatening for the tissue. So one paper discussed how hyperbaric oxygen is being explored to try and salvage that tissue. The idea is to dramatically boost oxygen delivery, getting it past what the damaged circulation can handle on its own.
Okay.
And they mentioned a specific study comparing hyperbaric oxygen plus standard care versus just standard care alone. The results suggested significantly fewer amputations in the group that got the hyperbaric oxygen.
Fewer amputations. That's significant.
It really is. Imagine, tissue that's gone gray after freezing. The therapy is trying to pump it full of oxygen, give it a chance to recover, maybe avoid amputation altogether.
That's a powerful image. And, okay, beyond physical injury like frostbite, the sources also mentioned research into neurological recovery, specifically after traumatic brain injury or TBI. Even the milder forms, which, as the sources note, can leave people with these persistent, really difficult symptoms. Fatigue, dizziness, brain fog, and often without one clear, effective treatment.
Right. TBI is complex. The research suggests that after an injury, even a mild one, brain cells might be struggling, starved for energy, dealing with ongoing inflammation. So hyperbaric oxygen. The thinking is it could potentially help, maybe by providing that much-needed oxygen as fuel, reducing inflammation, promoting the brain's own repair mechanisms.
So it's supporting the brain's recovery process.
Potentially, yes. The studies discussed in the sources pointed towards improvements in things like post-concussive symptoms, sleep, even balance, especially when it's used alongside other rehab efforts. You can kind of picture the injured brain needing energy and building blocks to fix itself. The theory is hyperbaric oxygen might help supply some of those crucial components.
Okay, so looking across these examples, tough inflammatory diseases, circulation crises like frostbite, brain injuries, it seems like hyperbaric oxygen is being investigated for a really surprising variety of issues.
It is. And, the sources are quite clear on this. These eight are complex conditions. The evidence for many of these emerging uses, it's definitely still developing. We really need more large-scale, rigorous studies to figure out exactly how it works in each case, who benefits most, and how best to use it. Because it's often an add-on therapy used with other treatments.
Right, it's not usually a standalone cure.
Generally not for these emerging areas, no.
Got it. But still, just understanding where the research is pointing and the potential reasons why, affecting oxygen delivery, inflammation, repair, that knowledge can be really empowering, especially if you or someone you care about is dealing with one of these tough conditions.
I agree. And it leads to the thought that, well, the source is kind of sparked for me. If hyperbaric oxygen seems to influence these really fundamental biological processes, things crucial for healing across different parts of the body, you have to wonder how many other conditions might eventually benefit as we learn more, as we get a better handle on these mechanisms. What else could it potentially unlock down the road?